All right, so let's get this show on the road here. Um, First off, I'm going to go ahead and share my screen with everyone. Okay, so it should be coming through. If you're a little queasy, my apologies there. It might be a little much for you to see. But this is the video that I have recorded of the pig dissection. I'm going to walk you through this here, so just go ahead and get started with video. I do have it muted so that I can provide the commentary. There is commentary on the video, but it's just, I think I want to be able to discuss it a little bit tonight. So the first thing I'm pointing at right there is called the bladder. And the bladder you can find connected to the umbilical cord, and it's sort of a muscular bag that sort of basically sets at that position. One of the things you need to do is really make sure that you're imagining. I know this is a little dark. I don't mean to be dark, but imagine you're laying there and where your body positions would be. That's why we choose a fetal pig, is it's very much like humans. But if you imagine these are your two legs, your bladder would be right there, right above your groin area, lower abdomen is where you would suspect to see that. So pointing at the bladder here, this is some of what I was talking about. This is some of the shaky camera here. So just kind of give it a second, zooming in, kind of working through that. All right. So now what I'm pointing out is the colon. Now, a colon being a little tricky here. I hope it doesn't do that every time. But colon really is the lower part of the large intestine. And this is where a lot of people develop cancers and things in their life. There's a lot of different risk factors. One of those happens to be eating a lot of red meat. It seems to be linked, and especially a lot of grilled meats, which I really enjoy. So you got to just kind of keep that in mind. Just because it's a risk factor doesn't mean it's going to directly cause colon cancer either. It can just up your chances. But as you see right here, this is a spiral colon where my mouse is pointing at. That's the lower large intestine. They call it spiral colon or large intestine, either one. But it'll spiral down and into the colon. Now, the rectum is actually where the anus is and up into the body cavity. You can't quite see it right here, but the rectum would begin right around where that mouse is at. So, again, forgive my sort of poor camera work here. I wonder if I can somehow speed this up. So, let's do this 1.5 times. Okay, we're going to do this 1.5 times since I can pause from time to time. So, that's what I'll do. We'll speed this up a little bit. Right there's the kidney I'm pointing at. Imagine where your kidneys are. Again, hopefully I'll zoom out so you can see this, but imagine you're laying back on your bed, say back down. You can imagine your kidneys would be in your lower back, lower bottom right and left portions of your back is where you suspect your kidneys to be. And they're in the same positions here on this pig as well. Kidneys play a large role in filtering out urine, making sure your hormonal balance stays intact, and also your salt balance in the body. So kidneys showing you the positions there. So this is all small intestine you're seeing right here, small intestine, and then that's the large intestine right there. So just sort of giving you an idea. There's a lot of small intestine in the body, tremendous amounts. What I'm pointing at right there, that's the pancreas right there. No, excuse me, that's cecum. The pancreas is right in here. So right here would be the pancreas. The cecum is the sac on the large intestine. It just kind of helps aid in digestion. Just so you're kind of familiar here, when you take your quiz, you're going to be asked to identify these positions from pictures. Well, some of these pictures are mine, some of them I've got from the internet, but they'll be pointing at different things, and I'm going to need you to know where those are. So if you're studying, this video is a direct study for that, just kind of give you an idea. So again, I'm showing you cecum right there. Cecum is this pouch. See what we're going to next here. Mesentery tissue is what that is. So the mesentery tissue, let it focus here. There we go. Mesentery tissue is these veins and arteries that run up into the small intestine. As your body digests food, it runs through your stomach, and your stomach does a lot of the large mechanical digestion, but then into the small intestines. So it'll travel from the stomach and the small intestines, and that first space in between the two is called the duodenum or the duodenum. Now, I've always heard it pronounced duodenum, but I've heard a couple of people say duodenum, so if you've ever hear it both ways. But the duodenum is basically the very first portion of the small intestine. But as you see, these small intestines, they're quite numerous. And I mean, they go on for a long time. And you have all of these arteries and veins that run up to them. And these are absorption sites. It's able to absorb out this, basically the food, the nutrients that are in your food. It's able to get it into the bloodstream right here, and you can sort of see that. So that's the stomach right there. Stomach, you probably can get that one. That one shouldn't be too problematic for you. I'm showing you the spleen now. The spleen is on the side of the stomach. That does a lot of blood filtering, so that helps a lot there. So there's the, looks like I'm going to show the duodenum, I think. We're seeing what's going on here. I can't remember. I had a student doing the probe, but I can't remember what they were probing at here. I think that looks to be the duodenum. It'll probably come back to it here. I think this in the commentary, I even kind of comment about, not sure where they were pointing. That's the gallbladder right there. So I'm pointing at, let me pause this. So the gallbladder would be right in here where this mouse is pointing. Right here would be the esophageal sphincter. And the esophageal sphincter is right at the top of the stomach, right where the esophagus comes in. And it's a muscle that controls stomach acid and allows food to enter. When you're belching, you're basically opening that esophageal sphincter and allowing the gases to escape. But a lot of people develop what's called GERD, or gastrointestinal something disease, basically heartburn. It's really severe heartburn. And I suffer from this as well. If you eat too much or the wrong types of foods, it can sort of force its way through that sphincter muscle, creating acid reflux. And that sort of happens from right there. This is the liver. This large organ right here is kind of beat up. That's one of the largest organs in the body is the liver. And the liver functions a lot of filtering and taking out different poisons and problems in the body. A lot of times alcoholics that consume too much alcohol often, they'll have sclerotization of the liver, and that's just where the liver is attempted to filter that poison. Alcohol is a poison, and you filter it out so often that your liver gets damaged. So that's sort of where that's coming from. We'll sort of watch the video and sort of see where we're heading off to here. I'm not for sure where we're pointing at next. Like I said, this video needs a lot of work, and I would like to kind of do some changes. Yeah, so I'm showing you the esophagus right there. And it's some poor camera angles. Maybe we'll slide it around in just a moment. But what I've done poorly here is there's basically two tubes here, and I want the side shot. And hopefully I'll zoom out and give you that. Okay, it looks to be right there. Okay, yeah, so you can see there's a tube right here. And then I had a bigger blue tube in the back. So back here, this one tube is the esophagus. And I'm going to rewind just a touch because I want you to see that esophagus very clearly. And the other large tube in that body cavity, and if you can imagine, this is the liver, these are your lungs. So somewhere right around where your ribs end, there's a muscle there. It's called the diaphragm. The diaphragm is what allows you to function, to breathe. It creates basically reverse pressure in your lung cavity, allows your lungs to inflate. In that body cavity, what I'm pointing at is there's really two large tubes. The one when the student has hooked right here with that probe, that's called the caudal vena cava. And that's the largest vein in the body. And that's coming out from the heart. And then right here, right behind this knuckle, and we're going to hook it in just a second, that's the esophagus. So that's the other large tube. There's another one in the back that we haven't seen yet. That's called the aorta, and that would be the thoracic aorta, and we'll talk about that in just a moment. But it's another large tube. And that's really why, that central area, think about your ribs. What's their purpose? Their purpose is to protect the lungs and just your chest cavity in general, because there's so much important basically plumbing and tubes in there. I like to think of veins and arteries as tubes. It kind of takes the mystery out of it. So that's the caudal vena cava right there. And then I'm getting rid of the hook right there. So yeah, and there you go. That's the esophagus right there. And that'll roll right into the stomach, passing through that esophageal sphincter. So let's see where we're headed next here. Okay, so I'm showing you the gallbladder. Very good. There's a great picture of the gallbladder. You can see it's this little pouch right there, and it's usually on the right lobe of the liver, on what we call the anterior portion. So posterior portion. You have anterior and posterior. Anterior means closer to the front, and posterior means closer to the back. So if you can imagine this animal, the very anterior position would be the tip of the nose, whereas the most posterior position would be the tip of its tail. So when we look at the liver, I said it was on the right lobe of the liver, which means it's on the pig's right, not your right, the pig's right. And from this right lobe, it's on the posterior position of that. So that uses a lot of anatomical terms to kind of give us a position in the body. So you're going to have right there the gallbladder. The gallbladder will flow right down through this tube right here. This is called the common bile duct, and it will empty bile into your stomach. And bile is used a lot for digestive purposes. Gallbladder attacks can feel like incredibly severe heartburn or even a heart attack because they're emptying so much bile and it's so inflamed and painful. It's in that same area. You've got a good shot right there at that esophagus coming into the stomach. You can see that esophageal sphincter. So that there's your stomach. This is that gallbladder, small intestine. And you can see that esophagus coming in right there, the esophageal sphincter lies. And I think that's the commentary I'm giving you right there. So this right here, this tube right here, this is it's part of the umbilical cord, and really it's called the umbilical vein. And I think you continually keep this in your body, but it kind of gets cut off with our belly button. And I'm not really for sure of its purpose beyond attachment to the placenta. Remember, we're placental mammals, meaning the placenta has to lay down its capillaries within the uterus of our mothers, and then we're able to exchange blood back and forth. And that's how we grow and develop. So it's through these veins, like the umbilical vein, in which we get a lot of the nutrients that we need. So we'll kind of follow along here for just a moment. I think I'm going to show you the pancreas now. Yeah, that's the position for the pancreas right there. And that's perfect. You see the stomach again, it's posterior to the stomach. This is kind of fatty, yellowy mass right here, and that's your pancreas. The pancreas is very important. Pancreas controls a lot of body functions. One of them specifically is insulin production. If you're a diabetic, my father's a diabetic, he has to take insulin. That's because of a pancreas that's not functioning properly. Pancreatitis can be inflammation of that. It can be driven over a very fatty diet. There's quite a few other reasons for that. I know dogs can get pancreatitis really bad. This was happening back with these grain-free diets we were on. The grain-free diet is great for a wolf, but your dog is not a wolf. Your dog is a canine dog. While they are the same species, doesn't mean that they're the same animal now, because artificial selection has played such a role that we've created an animal that consumes our diet now. So it needs grains and starches and plant material in order for it to survive properly. So a lot of these grain-free diets were causing heart attacks and pancreatitis because it was just too much fat. They need a balanced diet just as we do. Now, cats are different. Cats haven't been domesticated near as long as a dog. And a good sign for that, or a good example of that, is cats will go feral very quickly. Feral cats are basically just sort of cats that someone's had, and they no longer really come home, and they're kind of wild in a way. And these are a big ecological problem. Dogs, it takes a lot for a dog to go feral. They can, but it's usually in packs of wild dogs in cities and stuff like that. But even then, there's still quite a bit of domestication to them. So then that's just sort of some signs of it there. So again, pointing at the pancreas right here. So see where we're headed next here. Okay, showing you the liver. Oh, no, excuse me, that's not the liver. That right there is the diaphragm. Right here's the liver. So you've got the liver that's posterior to it. That's the diaphragm. If you remember, I said that was the muscle that connects and creates this actual cavity. So when you're dissecting the pig, or yourself, however, and you imagine your ribs creating a body cavity, you really do have a cavity separation between the abdomen, which is your stomach and intestines, things like that, and then and also your liver. And then right anterior to that liver, you have the diaphragm. And that diaphragm sits there and seals off what we call the thoracic portion to really your chest, where your heart and lungs are located. And it has to seal off because it creates negative pressure. When you breathe in, it's causing that diaphragm to move from where my mouth is here downward. And it's creating a suction. It's creating negative pressure. And what happens is it has to inflate something to fill up that cavity space. And what it inflates is your lungs through bronchi and through basically your nose or mouth. It'll come right down through this path. It'll pass through the larynx, through the trachea right here. So that's larynx. If you ever heard laryngitis, that's right there. That's where your voice box is and vocal cords. And then these are also going to be, excuse me, these are going to be zoomed in on in a moment. Just kind of letting you know a little ahead of time. Then it comes right down through the trachea and then enter the lungs. And right here is the left lobe of the lung, and over here is the right lobe. And the reason, again, it does that is negative pressure from the diaphragm. There's the lungs, pointed those out there for you. Yeah. Okay, so we're zooming in here. Probably going to start getting into some stuff here. Okay, so that right there is the pericardium. Now, the pericardium I've cut off already because I've had to dissect the heart. But the pericardium is essentially just like an envelope of material. It's a membrane. Think of it almost like a Ziploc bag around the heart. And it'll kind of protects the heart, but it can also fill up with fluid. And if you ever heard of someone having congestive heart failure, what's happening is there's a lot of buildup of fluid within that pericardium, in between the heart and the pericardium, forcing the heart to really have to struggle to beat to work through that. So remember, a heart is a muscle that flexes, just like your arms, legs, whatever. And as it's flexing, it's contracting and expanding. And as it does that, if it has less space because there's fluid buildup around it, then that can be congestive heart failure. And that pericardium allows for that. Usually fluid buildup is protection too. We generally do that to try to protect ourselves, but it can kind of shoot us in the foot sometimes. So that's your heart right there. Obviously, it's a big heart. You can see it pretty clearly. It's one of the most dominant portions of the body. Okay, so I'm going to show you heart chambers now. So it's really important to note that left and right is important now because I've rotated the animal in which we are looking from its head down towards its feet. Okay, so this would be the animal's right arm. Over here would be the animal's left arm. So we're going to be showing you heart chambers. And when you dissect a heart, there's 4 heart chambers. There's 2 ventricle and then 2 atria. And this is a ventricle right here. This would be the right ventricle. And you're going to see that a little clearer in a moment. And then you also have the right atrium right here. The atriums are on top, ventricles on the bottom. Same thing for the other side, left atrium, left ventricle. So right there, I've got the probe in the left ventricle at the tip right there. You can see the atrium really well right there. That's the right atrium. Where I've got the probe at right here is the right ventricle. So you can see that chamber right there with that red coming out. What that red is this latex dye. So this animal, when it was euthanized, I think these animals are from pigs that somehow, I'm not for sure how we end up getting them, but they're aborted pig fetuses, and they're in some sort of specialty animal facility. I don't know all of the background here. If this is concerning to you, you can look up and kind of look into Carolina Biological Supply and see more about it. But to me, I kind of feel comfortable here because I feel that this animal never breathed, and it gives us the opportunity to learn these body parts and kind of study about these anatomical positions as well. So if you're kind of struggling with that as well, I know some students in the past have had that. I just kind of want to bring that up. But you can see really good here. And again, they inject latex into these arteries and veins, and that's why you're seeing it right there. In that atria, you'll see a lot of that latex. Right there, there's the aortic arch coming in. So you may see that on your quiz. This is called the thoracic trunk right here. That's the thoracic trunk. Or excuse me. Yeah, thoracic trunk, I think is what that is. I'll double check that in just a moment. Can't remember the terminology that I've used. I want to make sure that the quiz lines up with the material here. So what I'm pointing at right there, that's thoracic aorta for sure. So you can see, I remember telling you about the 3 big tubes in the thorax region, which again is contained in by the lungs, the heart, the diaphragm, that kind of thing. But that's the thoracic aorta, and that's the largest artery in the body as well. So that's a really, really super important portion right there. Okay, so I'm pointing at, well, this is again why I kind of wanted to make sure that I kind of spoke to you here, because I kind of go all over the place. Yeah, so I did tell you the incorrect term there, so hopefully I'll point at it again. But it'll be the pulmonary trunk, not the thoracic trunk, the pulmonary trunk. Right there, where that's pointing right there, okay, that's the cranial vena cava. Remember earlier I talked about the caudal vena cava, and that's the largest vein in the thorax, but now we're in the cranial region. That's right here in your neck. And that's where all of the blood from your head drains into before it comes into the heart. So it kind of comes in this direction right here and goes out. Cranial vena cava there. Right there, I'm hooking, I have the student hook the carotid artery. That would be the right carotid artery, right there next to the neck. Doing something here at the heart. I think I'm showing yeah, I am. I'm showing the aortic arch. See where that probe's touching right there? I may call this one of two things. I'm either going to call it the pulmonary artery or the pulmonary trunk. The pulmonary trunk is the more proper term, but pulmonary artery is used sometimes as well. Okay, so right there, this is the carotid artery and excuse me, coronary artery. I got my C's mixed up. Coronary artery, and that goes across the heart. And what those do is those really allow the heart to beat. They supply blood. Remember, when you're looking at, a heart, it is a muscle, like I said earlier. When you've got that blood pumping through there, that's what allows that muscle to function. So a heart attack occurs from blockages in these arteries and veins. So this is the coronary. You might hear a heart attack described as a massive coronary, and that would be why. So I'm showing you that caudal vena cava right there. That's a good look at it. Okay, so I'm showing you, I'm trying to get to this lung portion right here. And this is I'm going to try to see if I can get a good image of it here. If I can, I don't have to have it. I can show you, I got a diagram pulled up. That right there, that's a carotid artery. The student must have hooked the wrong one earlier. So that's the carotid artery. If you imagine right down next to your neck, so find your neck, find where your what would be called the windpipe or the trachea is. On either side of that, laterally, you're going to have a carotid artery. And that's the largest artery in the neck. And then right next to that, you're going to have two sets of jugular veins. You're going to have your internal jugular and external jugular. And you can see right here, this is a good picture of one of those jugular veins. Right there looks to be the internal jugular. So this gives me a good opportunity to talk about what arteries and veins do. Does anyone know what arteries and veins do that might be here tonight listening? You got any background of all with arteries and veins? Okay, might be typing it in. But basically, arteries and veins carry blood throughout the body. It's a pretty simple thing. But one carries blood one direction, one carries blood the other. I like to think it like this. Arteries carry blood away from the heart. Veins bring blood to the heart. So that's kind of how you think about this is veins are always bringing blood to the heart, okay, where arteries are running away from the heart. And that's sort of how this function generally works is it runs to and fro. And I'm actually just going to look up the artery definition here while I'm talking to you. So it just says distributes oxygen-rich blood to the body. If you do artery versus vein in Google, you can see what are the differences here. Arteries carry blood away from the heart. Veins carry blood towards the heart. Now, oftentimes you hear stuff about oxygen rich and that type of thing too. And I'm going to caution you here about oxygen rich because it can be kind of tricky. But if you think about the way you breathe, and I'm going to show you this image right here. I think this will do it. Yeah, this will do it right here. I have to take this off the screen. So what I have here, this is heart and basically lungs and how they're connected. So you can see veins here, veins how they're flowing. See, they're blue, and then you've got red flowing right here and from the lungs into the heart and type of things. So again, arteries are carrying blood away from the heart, and veins are carrying blood towards the heart. Problem is here, you can't really tell what's what because you got red and blue. And you think, oh, that's easy. Red's arteries because it's been arteries the whole time. And blue, well, blue's veins. Problem is, as you see, it's not the case. This is actually a vein right here, and this is actually an artery. So this is not the best image, but artery versus vein, pretty simple thing here. We're going to hopefully we can see the pulmonary system. I really want to see the pulmonary artery versus vein. That's what we're looking for. Okay, this looks pretty good right here. You can see that this red here is artery, and you can see the blood flowing out of the heart. And then you see right here, this would be what they say the superior vena cava. If you've taken anatomy, we also use the word cranial as well. And where it says inferior, that the term that you may hear is inferior, we say caudal meaning tail. So these are those two vena cava we're telling you about. You can see them bringing that blood into the heart where it's then pumped out. So then, how does it actually work when you breathe? So if you breathe in, you're breathing in oxygen through your nose and mouth. It's entering the sacs in your lungs. And as you expand, excuse me, as you take a deeper and deeper breath, what you're doing is you're blowing that balloon up essentially bigger and bigger. And as you blow a balloon up, the skin gets thinner and it allows for diffusion to happen. So oxygen will diffuse from the air in which you breathe, which is an area of high concentration, and it will then diffuse into the bloodstream through capillaries, which is then an area of low concentration. Because what's happened is your heart has pumped deoxygenated blood to that position, and it is now waiting to be reoxygenated by your breath. And when it's reoxygenated, it will then come through the pulmonary vein. You see that right there? That says pulmonary vein. But if you notice, it's red because what's happened is it's being reoxygenated. So the lungs have filled up. You've had that diffusion take place. You've got oxygenated blood that goes into the heart, and then the artery system pumps it around where it is then deoxygenated, comes back up into the heart through the vena cava. It is then pumped into the right and left, and that's your pulmonary arteries and stuff. You can see right there, see pulmonary artery is right there. So that's that big trunk I was kind of telling you about. And then it's pumped into the lungs, and into the lungs, then you'll be able to reoxygenate it, go back through the pulmonary vein and into the heart again. This is a very complicated system, and I recommend you study this a little bit, follow these arrows. I typed in artery versus vein, but what I'll do is I'm just going to open this up like this right here. And let me just download this image here. And I will then share it with you. Now, I tell you what, I'll put it on the Moodle site. I think that'd be the best place. And I'll go ahead and do that right now before I forget, because that's probably the best one I've seen yet. I hadn't seen that one. So we're going to go ahead and do this right now. So if you just bear with me just a moment. Okay, so right there, we're going to put it right above right there at your quiz here. So we're going to upload. And then it's right there above your quiz. It even shows it on the Moodle site. So that's really good. So I'm glad to have that up there for you. But that's a tricky one that you will be asked about on the quiz. So make sure that you understand how this system works right here. Make sure you understand when you breathe in what happens next. And again, it's a pretty simple system. If you think about it, veins run to the heart, arteries run away. Veins usually bring deoxygenated blood. But you can't say always because of that pulmonary vein coming out of the lung into the heart. So let me get back to my video. There we go. Okay. So let me skip through some of this stuff. Again, showing you carotid artery, right and left. That's left. That's right. See what's up next. Should be some jugular veins. Yep, that'd be an external jugular right there, and that would be the internal jugular. So you can see both of them side by side. Internal's closer to the trachea, basically. External's further away. And if you want to use proper terminology, it's distal and proximal. Proximal means closer, distal means further away. Again, pointing out that cranial vena cava, or what we call the inferior or superior. I can't ever use those terms right, but that's caudal vena cava. Cranial and caudal make more sense to me. Cranial meaning cranium and head, caudal meaning tail. Let's see what I'm showing you here. Oh, renal artery and renal vein. So these are really important arteries and veins that flow through the body as well. They're involved right here. You can see the renal artery and renal vein. So right there's a good picture of it. I'm going to try to, double check this here as well. And I might show you a different image with some colorization. But renal artery and renal vein is basically a position. I mean, basically it's a blood supply to the kidneys. And, your kidneys, they do a lot more than we first kind of realize. We think, well, they filter our pee out. No, they do so much more than that. And this renal artery is the one on top. I just want to double check before I told you wrong. So this renal artery is right here. It's always on top, and renal veins in the back. And what this will do is this will allow for blood to flow through this kidney right here and control hormonal balances, control a lot of different metabolic processes. And then it'll pump back out up into the heart where it'll be reoxygenated. So that renal artery right there, then renal vein in the back right there. Again, showing you thoracic aorta there. Okay, getting my camera steadied in there. That's, yep, there's larynx. And trachea. Trachea is right below it. Okay, just got a few more things to go here. We're going to look into the mouth, and you can see the glottis and epiglottis right here. The epiglottis is actually the very tip of this organ. Glottis would be actually down inside of it, and that's what allows you to breathe and swallow using the same orifice, basically your mouth and sinuses. Right in behind this right here, and hopefully the pig will get set up here in a minute. There you go. You can see it pretty well. See that the opening is there. This is called the soft palate. You can kind of feel that. And behind that is where your sinuses drain. So if you ever have an allergy attack, or if maybe you're having a sinusitis or some sort of sinus infection, you'll feel this area sort of get aggravated. And sometimes you can take your tongue and sort of involuntary scratch that, and you don't even realize you're doing it. You can see this is hard palate right there, and then soft palate down here. And then I should take the probe in behind here in a moment, or I should have the student do that. So hopefully we're going to see that. Yeah, glottis and epiglottis. See how I'm coming in behind that? Yep. So right there. Okay. So I'm in behind that, and that's your sinus area, but I also call that the nasopharynx. Nasopharynx is what that's called. Nasopharynx, right there. You can see it wiggling around. Umbilical vein. Okay, so that's the urogenital opening. It's a male, so it would be right there. Not sure what we're going to next here. Again, probing around the kidney, I'm not sure. Oh, the ureter. Yeah, ureter or ureter. That's the tube that runs from the kidney into the bladder. So that's where, again, your water sort of balance comes from. And you can see it's kind of a squiggly line running down through there. I do think that's the last one. Yeah, it is. Okay, good. So if you've made it to this point, then you've seen that that was a pretty shaky video. It was well, it was all over the place. And I just wanted to kind of give you a second of me pausing it and showing you things along the way so that you understand this. Does anybody have any questions about anything? Okay, well, if that's the case, then I'm good. If you are, let me know if if you run into any snags or anything on this. So let me double check something here for us. Yep. So yeah, so you'll need a password for this one. That password is Bones, 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 all lowercase. That'll get you into the quiz so that you can take it. Remember, take your time through it. You're going to have 2 attempts. If you wanted to run 1 attempt and go back and restudy and run another one, that's fine for me too. I don't really mind as long as at the end of the day you understand the material. That's really what I'm going for. We are starting to wind down in classes and stuff is really starting to kind of come to the end. Make sure that you're staying caught up. If you got any outstanding assignments, reach out to me. Let me know that that's there. You know, and we can try to get those caught back up. I'm just going to sort of show you real quick what we've got left. Let's just close all here. What we've got left here is microbiology. And that's your last module, really. And that'll start the 28th. So anatomy and physiology, this will run through the 27th. So that's going to run through your Thanksgiving break. And then after that, we're going to move into microbiology. Microbiology, you're going to have a worksheet lab there. We're going to do probably another sync session for that one, just walk you through it. Pretty simple stuff. But then your final exam will not be a cumulative exam. I hear this often. It will actually be a combined AP and microbiology exam. So anatomy, physiology, and microbiology. So it will be this unit, that unit, you'll take your exam. It should be pretty good. I think everything should be good. I think that course evaluation should be loaded up there. If it's not, I'll look at that. I saw that module earlier. Yeah, right there it is. Looks like it comes, yeah, it's all, yeah, course evaluation's all right there. So I have a different view than you do. My view shows a little bit different things. You don't need this evaluation tab because yours is right there. If you'd like to go ahead and complete that, that would be good. Let's see what we've got here. We've only got a few assignments left. So we got only 2 quizzes in this unit. Remember, you do have a few quizzes here. You have 1, 2, and 3. PIG terms, this term list will help you for that dissection video again. That's the list that I used, and it will also help you on your quiz. Again, you're seeing some things that aren't there anymore. We used to do this with a frog, and frog just doesn't work near like a pig does. A pig is much better. So if you need anything, be sure and reach out and let me know. Let's all finish strong, and hopefully we'll finish the semester and everybody will be happy and have a good break. So talk to you soon.